the first question we wanted to start off with is maybe if you could tell us the story of how maternal mental health and perimental health came to be so important to you.
Yeah, so right, this was a combination of personal and professional experiences that I've been experiencing across my life. So first of all, as a mother myself, right, I got the opportunity to have this deep understanding on the challenges and emotional challenges and struggles of women during this perinatal period, and also that men experience as well. And then, before pursuing my PhD, I worked as a clinical psychologist in a shelter for women facing vulnerability social situations. And so, many of these women were coming with their children, or they were pregnant, or in the postpartum period. And through listening to their stories and to their struggles, I realized how limited mental health is supported, perinatal mental health is supported in Portugal. So this was my first perception, was that in Portugal, the support and the services were somehow meager. And witnessing their struggles and the lack of resources that we would have available motivated me to make a difference in this field. Then, during my PhD, I was introduced to non-invasive brain stimulation strategies, which have been researched, and actually they are nowadays evidence-based treatments for depression and anxiety symptoms. And this can be nice alternatives to medication, which is one of the struggles of women that experience mental health symptoms during pregnancy or while they are breastfeeding, right? They resist medication or they avoid taking medication. And so when I was starting to work with these non-invasive brain stimulation strategies, my first thought was, okay, this can be something that we could eventually suggest to women as an alternative treatment because it's safe, because it can be alternative to medication or an alternative to increase the dosage that they are taking. And so let me see what has been done about this in the perinatal field. And by then, more or less at the same time, I started working at CNAIC in one particular research group that was simply dedicated to perinatal mental health. And so I had like the perfect background to develop my ideas and to do my search with very nice experts around me. And yes, collaborating with these colleagues was a keystone in my path. Another very significant milestone was the fact that I had this opportunity to propose this cost action in perinatal depression. And so by then I was working with my local colleagues, but with this cost action that was actually funded in the end, I've been having the opportunity in the last 4 years to work with experts from around the world. And experts from very, very different fields and backgrounds, from economics, biologists, medical doctors, midwives, psychologists, psychiatrists. It's very, very diverse. And with all these people, with this network of whom Make Mothers Matter is part of, I've had the privilege to work on perinatal depression and have a broad sense of the stake of the affairs, not only locally in Portugal that I had already, but now at an European level, actually. And so this experience further deepened my commitment with improving perinatal mental health and the well-being of mothers and fathers during this period.